Greetings, health champions. Happy Friday. This is the last day of my recording, which I committed to. 6 days on a roll, talking about the 6 pillars of lifestyle medicine during the Lifestyle Medicine Week. I hope that this has been enlightening for you. If you're already on this wellness journey, maybe it's rekindled your love, maybe you've learned one or two things. There's a lot to unpack using the 6 pillars. So I try to get to the foundation and reach out to me if you have specific questions, if you want to learn more. I try my best to share resources with the American College of Lifestyle Medicine. So I want to thank you for investing in your health and investing in yourself. So I'm Dr. Babalola, Dr. aka Dr. Babs, your wellness strategist. And we're going to dive into the last pillar, which is avoiding risky substances. But before we dive into that, I want to share a little bit about me. So just watch this brief video and I'll be right back. All right, so welcome back. I'm Dr. Babs. If you're just joining in, your wellness strategist, welcome to our final recording during our Lifestyle Medicine Week as we talk about the pillars of lifestyle medicine. Today, we'll be talking about avoiding risky substances. I would like to share that this is just for informational purposes to assist you on your wellness journey, but does not represent physician-patient relationship. Well, with that being said, let's go ahead and talk about what we will be reviewing today. We're going to discuss how does alcohol and smoking we're going to do both. How do they affect our judgment and our ability to be present? And how much is actually safe? Because there's a lot of controversy about, oh yeah, you can drink 1 cup, you cannot drink, there's all of that. So we're going to dive into what the research is saying. All right, so let's start off by noting that tobacco products kill 1 in every 2 people that use them. All right, and it's estimated that 480,000 related smoking deaths in the US. Can't even begin to imagine what it is worldwide. And then for alcohol, 15 million adults in the US have one form of alcohol disorder or the other, whether it's binge drinking, whether it's heavy drinking. And the prevalence is actually between 18 to 34. So I want to just share my slide where we talk about the complications, what arises, and then we'll talk about a few numbers. All right. So to start off with, see the health effects of tobacco use. It's numerous. Cancer has been linked to alcohol as well as tobacco use. And here you see, just imagine all the fume, the fume that it gets into the body. What it does, it damages the vessels. Not only does it damage the vessels, but it also causes a lot of obstruction, a lot of, it's just the patency of the vessel is no longer there. So we have cataracts developing, macular degeneration, and that just means degeneration, wear and tear. Diabetes is more at risk because you're messing up the insulin that your body needs to process the breakdown of carbohydrates. The COPD, as you can imagine, the lungs are traumatized with all the fume that is in there. You can imagine dental issues, Bone loss is a big one. Sexual dysfunction. Do you know how many patients I have, male patients that come to me and tell me that they need help, they need Viagra, Cialis, and that is just because the blood is cut off into the genital area, so it's not able to perform its duties. So yeah, so many things, fertility problems, poor wound healing. So just imagine that you're in a building and there's just so much smoke you can't see, things are not working as well. Your immune system is also affected. Heart disease, so there are tons of things. And if anything at all you remember is that it causes a lot of obstruction. So blood doesn't flow properly and it damages the vessel, the lining of the vessel. Now, I want to share with you that, if you quit, you will begin to notice a difference. So within 20 minutes of quitting, the heart rate and blood pressure drops to normal. 12 hours, the carbon monoxide that has been built up, that begins to drop. Imagine what happens in 2 weeks. The circulation begins to improve, lung function improves, and as you go down weeks, you begin to get to, that time of the day. You begin to get to normal non-smoker levels. Of course, at 1 year, the risk of a heart disease, coronary artery disease, is half as those of smokers. So it's tremendous reduction. Just imagine all that smoke slowly sipping out. 5 years has been shown that the risk of cancer now, which cancer has been associated with smoking, just anywhere the fumes go in from the mouth all the way down to the esophagus, all of that is actually now also half. By 10 years, same thing. So you see the significant improvement over the years. What are other health benefits to quitting smoking? All the things that we said it causes, those would be the benefits. Stronger bones, stronger immune system. It always baffles me. And I know we are creatures of habit, so no judgment here. I have habits that I'm trying to get rid of. So, we are just creatures of habits. It's easier, like they say, to start a new habit than to break one. But I sometimes I'm baffled when patients come and they tell me they're having a cold. They always coughing, up frame, but when I ask, do you smoke? They say yes. They're trying to quit. So these are all the health benefits of not quitting. Now, with the smoke, before I actually get to the alcohol, they are definitely help. You just have to be ready. It's deciding which stage of change you are in. If you're in pre-contemplation, meaning that, I'm not ready. I like my smoking habits. I have patients that say they're not ready, and they'll let me know when they're ready. So, but whenever you're ready and you see what it's doing, it's a lot of healthcare cost. There's a lot of cost in your pocket. There's a lot of all of that. But when you're ready, there's definitely talk to your provider about it. Excuse me. Ooh, one of the pillars is sleep, so it's time for me to go sleep. I have I'm trying to reduce the lights, the blue light. Remember we talked about sleep and reducing the blue lights is something more that doesn't cut down my melatonin, but my melatonin is it's already kicked in, so it's time to go to bed. Anyway, that's aside. So for smoking, please talk to your provider if you're ready to quit. There are tons of, the National Smoking Quit Line. There are tons of medication, pills, there's patches, gum. All right, so please seek help, all right? Seek help. I've had several patients that have quit cold turkey. Some people have needed additional support. Now, for alcohol, there's always been that debate about how much is necessary, how much can I have, how much can I not have. I want to start off by saying that alcohol is measured depending on the drink and the container it comes in. So that's how you can tell the amount of alcohol. So a glass is not the same thing for a can. All right, so a 12 ounce of regular beer, it has about 5% alcohol, and an 8 ounce of malt, like 8 ounce of water, that same cup is about 7. That's a lot. And then a 5 ounce of table wine is about 12% alcohol. And this is the one I took. I finished the whole thing when I went for my reunion. I had such a wonderful time with my friends. It was lovely. It was like primary school reunion um, and secondary school, but I just went off the rail. And then we have the shots, right? The shots, that's even higher. So it's important to know this. You might want to screenshot this and keep it and reference it. Other information here just talks about, the containers and how much is in there. I want you to pay attention to the wine bottle and the spirit bottles. All right. Now, this is where there's a lot of back and forth. If you do not drink, do not start. Okay. Because again, like I said, habits are difficult to break. Um, so when it comes to how much, I know there's been studies in the past where they tell us, well, men can take at least two a day, minimum of 14 per week. Same for women, one a day, minimum of 7 per week. Anything more than that is considered excess. Now, we do have to pay attention to what it does to you. So even if you have that one and it still gets you all riled up, then that definitely is not one that you want to continue to consume. Okay. Now, in case you're wondering, excuse me, I'm going to bed after this. In case you're wondering about the alcohol use definition, binge drinking, that's just drinking enough that your blood alcohol level increases to 0.08. And then your heavy alcohol use is binge drinking more than 5 days in the past month. And then at risk is when it exceeds the level above for any day. So some of these definitions can be a little tricky, but I think the important thing here to emphasize is excessive drinking is for women when in a day, any occasion you drink more than 4. And for men, more than 5. And people that are drinking heavily, definitely for women 8, and then for men even much, much higher. So we need to pay attention to these numbers. All right. Now, summary just tells a summary here. We have cancer, we have depression, we have anxiety, chronic diseases, death. Disability is also one of them. So we need to remember and pay attention to that. So let's say you've identified that, yeah, you know what? I do have a behavior where, my kids drive me crazy. I want to take a cup of wine, or I've had a long day at work. Is this becoming something that you rely on and you need to relax? If it becomes something that you're doing over and over again, then you need to do that self-assessment. Are you needing to go out of the house to get it? Are you increasing the number of cups you're getting to get the kind of effect you need? You have to pay attention to that and be honest with yourself. You're your own best advocate, your own best teacher. So if you find that that's happening to you, then figure out what are those cues, what are those triggers. Is it emotional? Is it physical? So that you can find a replacement. Like, I used to be an emotional eater, food eater, and so I just make sure I'm full all the time, or I have my water, or I have my I take this really cool gummies, the ashwagandha. They're the goji berries. So they're right here, really cool. So that way I'm not craving sugar. I have my tea that calms me down. So find something to replace the habit of always wanting to drink wine. And of course, don't have it in the house. That's another one. You also have to pay attention to what's the reward. What's the reward you're trying to get out of it? So you have to break that loop, that habit loop. That's the best way. And then when you're breaking the habit loop, after you've done your self-assessments suggest it is time for a change. Then you gotta go ahead and set a SMART goal. And a SMART goal has to be specific. So what are you trying to stop? Is it the smoking? Is it the drinking? Why are you trying to stop it? Because of health reasons, right? So how are you going to measure that you stop? So I have patients that would have smoke a pack, which is about 20 in it. And every day they wake up, they always have to have like 2 or 3. So they decided to just do one in a specific time that they will smoke that one cigarette. So you want to be very specific. You have to be measurable in terms of numbers. You have to make sure it's attainable, right? Don't go and say, oh, well, some people can do cold turkey, but you don't suddenly have to say you're going to stop. You have to be very realistic as well about what you're going to do, how long you're going to do it. Is the time bound? Are you going to try it out for a month and see how it goes, or for a week? So that's where you have to set smart goals. If you're not clear on exactly what you're going to do and how you're going to get there, you will not get there. So in closing, I want to share this Warren Buffett's quote that says, chains of habits are too light to be felt until they become too heavy to be broken. So we want to break those habits now. Again, no judgment here. We are creatures of habits. Seek help with your healthcare provider for alcohol drinking. There's so many organizations that help. They have medications that can also help. I had a patient just on Thursday, and he unfortunately ran away from home, as he said, at a very young age, and got into a lot of fights, and now, depression over the years. He drinks and drinks. And when I was asking if he needed help, yes, I need help, but he feels like he's the only one that can help himself. So, again, that was an assessment of where he is, but he's seen a counselor. So all these things, we just need to be, if you need help, just seek help, because your health counts on it. It really, really counts on you. And there's strength in seeking help. There is strength in seeking help. All right. So call to action. Just do that assessment. Ask yourself, what's your behavior? Is it smoking too much? Is it drinking? You also want to ask yourself, what is making it come on? And be prepared for when it comes on. That's, like, maybe don't buy it in the house. Out of sight is out of mind. So I want you to feel free to send me a comment and let me know how this has benefited you. I hope it has. And again, once again, thank you so much for participating in this 6 days awareness global campaign about lifestyle medicine. I want you to know that you deserve to live at your finest holistic health, because you are worth it. So take care and God bless.